Hi, I'm Shoun. I work at the Bellevue Right at Home office. This is my coworker, Marilyn. She is the EEC of Bellevue's Right at Home office. Today, we will be doing a class on colostomy care. Before you start care, make sure you carry all your equipment. Gloves, something to clean it out with, washcloths, towelettes, anything. I have a towel for my barrier, and I also have an extra pad just in case. In some cases, when it comes to collecting the bowel movement, you can use a cup, like so, or you can use a basin. Sometimes, if you don't have those things, you can also use a trash bag or a bag. So, to start off, you always want to greet your client, make sure that you let them know what's going on and what you will be doing at that moment. After you do so, put on your gloves. All right, and now we're gonna go look. So, a colostomy bag is a bag that is connected to the abdomen of a client when it collects the stool. Inside this bag, for example, we have a little bit of loose stool in here. I'm gonna go get the stuff. So, before you open up the bag, you wanna make sure that you at least have a barrier to help contain the splash or whatever you cannot catch in the cup. You're gonna put it underneath the bag, as so. Once that is done, you're gonna wanna get the thing that you're going to use to collect the bowel movement and put it underneath as so as well. You're going to undo the tie, lay it flat in the cup as so. If you need to, you can hold it with one hand, and as you're doing so, you're going to push as so. Don't worry if you can't collect everything at one go. As you do that, you're gonna get your bowel movement, place that off to the side, and then you will get something to help rinse it out or clean out the opening so that nothing seeps out, basically.
Oh, here you go.
So, example. This would have either a little bit of soap in it. It can be warm, not too hot, but a little warm. You're gonna put it into the opening. Uh-oh, that is why we have the barrier. Thank you. As you do so, I'm going to clean this opening out real quick before I seal it. Now that it's sealed, I'm going to shake it up to help get the excess bowels in the bag. You don't want to rough it up for too much, just enough to help loosen off the stickiness. After I do that, I will open it up. I will get the basin, cup, trash bag,
whatever you're using,
and then I will pour that out. Thank you. Now after doing so, I will go one more time with a towel and clean the opening out. After seeing that it's been cleared, I will go and flatten it out to make sure all excess air is out. Once that's done, I will go back to sealing and take the barrier away, cover the client up, and you are done. That is colostomy care.
Awesome, thank you. Could I ask you one quick question about what I observed there? What if I were seeing somebody's bag and it seemed to be just full of air, but there was not a lot of stool in there? Is that something I would need to worry about?
Yes, because if there's too much air in the bag can pop or it can break the sealing from the abdomen. So In order to take the air out, you can just open up the seal, squeeze out the air, and then close it tight.
Okay, that makes sense. All right, thank you. I appreciate that.